Hi, my name is Marissa Ewert, and today I will be talking to you about scleroderma. We will be going over what scleroderma is, the causes, the signs and symptoms of the disease, the different forms of scleroderma, the organ systems that are affected, the treatment, the short and long-term consequences, and then we will summarize. Scleroderma is a type of autoimmune disorder where the immune system attacks and destroys healthy body tissue. It involves the buildup of scar-like tissue in the skin. It also damages the cells that line the walls of the small arteries. Scleroderma can be debilitating to the body. The cause of scleroderma is unknown. What is known is that a buildup of collagen in the skin and other organs leads to the symptoms of this disease. Some studies show that people with scleroderma have a history of being around silica dust and polyvinyl chloride. Scleroderma is seen most in people between the ages of 30 to 50, and women tend to get it more than men. Scleroderma can also occur with other autoimmune diseases. When scleroderma presents with other diseases, it is referred to as mixed connective disease. Signs and symptoms of scleroderma may vary depending on which parts of the body are affected. Almost everyone that suffers from scleroderma experiences a hardening and tightening of patches of the skin. The patches can be in the shape of ovals or straight lines. The amount, location, and size of these patches vary depending on the type of scleroderma. The skin of someone with scleroderma can appear shiny because it is so tight, and the affected area may have limited movement. One of the earliest signs of scleroderma is an extreme response to cold temperatures or emotional distress. This can cause numbness, pain, or color changes in the fingers and toes. This is also known as Raynaud's phenomenon. People with scleroderma may suffer from acid reflux, which can damage the section of the esophagus closest to the stomach. In addition to that, some people may have issues absorbing nutrients if their digestive muscles are not moving food efficiently through the intestines. Although rare, individuals with scleroderma may also develop issues with the function of their heart, lungs, and kidneys. These particular problems may become life-threatening. There are two forms of scleroderma: systemic sclerosis, which usually affects the internal organs or internal systems of the body as well as the skin, and localized scleroderma. This affects a local area of the skin. It is unlikely for localized scleroderma to develop into the systemic form of the disease. In systemic sclerosis, several clinical features occur. One clinical feature is Raynaud's phenomenon. This is a condition in which the fingers turn pale or blue upon cold exposure, and when warmed up, they become ruddy or red. This happens because of a spasm of the small vessels in the fingers. The more this happens, the more damage that occurs to the vessels. Eventually, these vessels become damaged to the point that they become totally blocked. This can lead to ulcerations of the fingertips. The esophagus is also affected in systemic sclerosis patients. Loss of the usual movement of the esophagus occurs, and as a result, food can hang up in it. Acid from the stomach can also reflux back up into the esophagus, causing heartburn. People with systemic sclerosis are at a greater risk of developing pulmonary fibrosis, kidney disease, and bowel disease. This happens because of the scar tissue that forms from the disease. This disease can also cause a person's blood pressure to rise. That can lead to other possible medical complications. As previously stated, there is no known cause for scleroderma. In localized scleroderma, the underlying problem is overproduction of collagen or scar tissue in the affected areas of the skin. In systemic sclerosis, there are three different issues going on at once. There are blood vessel abnormalities, fibrosis or overproduction of collagen, and immune system dysfunction or autoimmunity. In systemic sclerosis, the small blood vessels become damaged. This can also occur in the internal organs, and that is what is responsible for the kidney problems. In scleroderma, the balance of collagen formation and collagen breakdown is uneven. Too much collagen builds up, and not enough is broken down. When this happens, the excess collagen can cause fibrosis in the heart, lungs, and the muscles that line the GI tract. Collagen is made by fibroblasts. Fibroblasts are a type of cell in almost every tissue in the body. These cells can be provoked or activated to make more collagen. The immune system activates the fibroblast to produce collagen as part of the normal healing process. In systemic sclerosis, the fibroblasts are activated for no reason, and the resulting excess collagen production causes tissue damage, decreased flexibility, and malfunction of the organ involved. Another problem in systemic sclerosis is the abnormal regulation of the immune system. This results in an immune attack on the healthy tissues of the body. There is no cure for scleroderma. There are, however, treatments to help relieve some of the pain associated with the disease. For Raynaud's phenomenon, doctors usually prescribe calcium channel blockers. These medications are used to reduce high blood pressure. Calcium channel blockers affect the movement of calcium into the cells of the heart and blood vessels. This in turn increases the supply of blood and oxygen to the heart, all while reducing its workload. This causes the blood vessel muscles to relax and may slow the heart rate. For individuals suffering from joint stiffness and pain, non-steroidal anti-inflammatory drugs, or NSAIDs, are usually used. These particular drugs help relieve some symptoms caused by rheumatism. The drugs relieve these symptoms by decreasing inflammation, swelling, and stiffness. NSAIDs can be very harmful for people with certain medical conditions and lead to the development of stomach bleeding and kidney disease. Along with generic NSAIDs, COX-2 inhibitors, which are also a type of NSAID, can be used. These work by blocking the COX-2 enzyme, which is involved in inflammation. They relieve symptoms like inflammation, swelling, stiffness, and joint pain. In more severe cases of inflammation, low-dose corticosteroids can be used. These medications are used to provide relief for areas that are extremely inflamed. They significantly reduce swelling and redness. Along with Raynaud's and joint stiffness pain, individuals with scleroderma may suffer from gastrointestinal problems. For patients experiencing gastrointestinal reflux, antacids may be used. These work by neutralizing stomach acid to relieve heartburn and acid indigestion. These may be purchased over the counter, or a medical provider may want to prescribe a patient with a stronger antacid. For anyone suffering from intestinal dysfunction, prokinetic agents may be used. These are medications that increase the movement or contractions of the stomach and intestines. For severe impairment of intestinal movement, octreotide may be used. For any issues involving bacterial overgrowth due to the reduced movement of the intestines, antibiotics may be prescribed. People suffering from scleroderma may develop short and long-term issues with their health. Some short-term issues they may suffer from include dry mouth, jaw pain, chronic joint pain, decreased movement, and acid reflux. And we talked about all of those when we talked about the signs and symptoms. The long-term effects of scleroderma are much more severe. Individuals with scleroderma can develop painful ulcers on the tips of their fingers and toes over time. Because of the limited blood flow to those areas, the ulcers rarely heal. Over time, scarring of the lungs can be an issue in scleroderma patients as well. This poses a risk for these individuals to develop chronic breathing problems. Another issue that can arise over time is pulmonary arterial hypertension. This is high blood pressure in the blood vessels of the lungs. Anyone suffering from a chronic illness is also at a higher risk of developing psychological issues like depression or anxiety. This is true with scleroderma, as it does not have a cure at the moment. Gastrointestinal issues can also be a long-term issue. Although acid reflux is a short-term problem, prolonged acid reflux can damage the esophagus. Scleroderma patients may also develop Sjogren's syndrome. This affects the tear glands, decreasing the production of tears. As you can see, scleroderma is a debilitating disease that does affect several systems of the body. Although there is no cure, there are medications that can ease the symptoms of the disease. If you would like to learn more about this disease or donate to the Scleroderma Foundation, please feel free to visit their website at www.scleroderma.org. All of their proceeds will go to trying to find a cure for the disease. Thank you so much for your time, and the next 2 slides will be my references.